Welcome back. After a cancer diagnosis, the next step is considering which treatment options are best. Dr. Charles Nichols is the Associate Professor at the UF Department of Radiation Oncology joining me today. Good to see you, Doc.
Well, thank you.
And let's first start out for anybody who hasn't been to your facility, proton therapy. Talk about proton therapy and what exactly it is.
Well, proton therapy is a way of delivering radiation therapy for cancer, but because it's delivered with particles, we're able to contour the radiation dose very precisely around the tumor, around lymph nodes, with minimal radiation exposure to non-cancerous tissues. So it's a more effective way of doing radiation, but also a safer way of doing radiation.
Yeah, less invasive, right? I mean, because traditional difference between that and traditional radiation, I mean, this really gets into the tumor.
That's really the way to think about it. When you deliver conventional radiation for a cancer, generally there's a lot of dose that enters through the patient, the non-cancerous tissues, and exits through non-cancerous tissues. With protons, you can create a radiation dose cloud that very closely wraps around the tumor and the relevant target, so that, again, you get all the dose you want to get to your tumor, but because of this conformality, you minimize the dose to normal structures such as the bladder, the rectum, the intestine, the lung, the heart. It's just a very elegant way of doing radiation.
Which has a huge benefit to the patients, right? Because there's less side effects.
There's not only less side effects, because we have less exposure to the non-cancerous tissue, we're often able to intensify the dose that actually goes to the tumor. So we're not just giving less dose to the normal tissues. Because of that, we're able to give more to the tumor. And in a number of disease sites, it appears that we're improving the control rate, the cure rate, by being able to do it this way.
And let's talk, jump into what's new in prostate cancer in patients and the treatments.
Right. Well, prostate cancer is a large share of the patients that we treat. I believe we're up to about 5,000 patients over the 12 years that we have been in practice. And what we've found, particularly for patients with intermediate risk disease, we're seeing a PSA control rate that is about 10 percentage points higher at 5 years than what we would have expected with X-ray based therapies.
Is prostate cancer the most, I mean, I know proton therapy is used for all kinds of cancers, right?
Yes, yes.
But is prostate cancer the most used, or is it just the most seen?
I would say it's the largest share of patients that we treat, but it's not the majority of the patients we treat. We treat a lot of pediatric cancers. We actually have the contract with the British National Health Service, and we do the radiation for patients in the United Kingdom who come over here for proton therapy. We also treat gastrointestinal cancers. We have a large practice in pancreas cancer, a large practice in lung cancer. So we have a lot of other disease sites that we treat besides prostate cancer.
I think that's one of the unique things when you go to the Proton Therapy Institute, and I've been there, there's people from around the world that are flying to Jacksonville to get their treatment there.
Yes.
Because of how beneficial it is and for the patient.
Well, I think part of it is the technology that we have, but also the experience. I mean, we've been open for 12 years. We really got in on the ground floor with this technology. So, right, we're the fourth oldest center in North America. Now there are about 30 centers that are open around the country. But, like I said, so we've been at it from the beginning. Patients come not just because we've got fancy technology, but we have the specialized experience to know how to take advantage of that technology. That's something you don't see in a lot of the newer centers.
So true. And some of the other things that you guys do that I don't make a habit of touring, proton therapy, but when I've gone to yours, it's not just the treatment they're getting and the science and all that stuff. Mm-hmm. It's the entire experience when they go in there. You guys really do a lot of stuff for patients and their families, because they're going through a brutal time in their life, and you guys do a really great job, I feel, of really making that process as smooth as it possibly can be, and surrounding them with other people going through it.
Yes.
Do you find that's helping the patients in their recovery and through their treatment?
It's a great part of what we do, but it's also a necessary part of what we do because a lot of the patients come from far away. And a lot of the patients, actually virtually all the patients, we're treating for curable malignancies. So they might be here from somewhere else in the United States or from overseas, and they're here for 8 weeks. And so, and a lot of them are, otherwise they're outpatients, they're not in the hospital.
Right.
So you have to create an experience where they don't get bored to death being at our facility for 8 weeks. So we really work hard to keep them engaged with each other, keep them engaged with the community, get them out to the activities in Jacksonville. That's the fun part. That's really the fun part of what we do.
Yeah, you're doing great work, and like I say, every time I talk to you guys, I am so happy you're in our city doing what you do, and I hope I don't have to come see you ever.
That's fine, and Jacksonville's a great place to be.
Good to see you.
Hey, thanks a lot.
Thanks for being here. And we want to thank UF Health Proton Therapy Institute for being here and sharing this information and their services. For more information, you can visit floridaproton.org or call 904-588-1436.